Hi everyone, Assalamualaikum warahmatullahi wabarakatuh. I'm right here. I want to explain about family planning and contraception. Good morning. My name is Lina Yuliana. I'm a student of Midwifery Polytechnic Karya Husada. Today, I'm gonna tell you about this topic. First, I'm going to explain about family planning is. Second, what is the benefit of family planning? Third, I'm gonna tell you about the method of contraception and the benefit and deficiency of contraception, and then set effect by using contraception, and then closing. First, what is a family planning? Family planning is an effort to regulate the number of births in such a way. And how about the benefit of family planning? There are 4 benefits by using a family planning. The first is to prevent the emergency of the dangers of pregnancy too early. Second, prevent the emergency of danger of pregnancy is too tight. Third, prevent the emergency of the dangers of pregnancy that are too based on the spacing of birth. 4, prevents the emergency of the dangers of getting pregnant and giving birth too often. Now, what about the contraception method? There are 5 contraception methods. First is LARC, or long-acting reversible contraception, which is intrauterine method. Second, hormonal method, short-acting hormonal method. Third, barrier method. 4, emergency contraception. 5, then what about LARC, or intrauterine method? There are 2 options. First is intrauterine method, and second, intrauterine method. I'll explain. An intrauterine device, or IUD, also known as an intrauterine system, or IUS, is a small T-shaped device that is inserted into the uterus to prevent pregnancy. A health care provider inserts the device. An IUD can remain in place and function effectively for many years at time after the recommended length of time, or when the woman no longer needs or desires contraception. A health care provider removes or replaces the device. Second one is implants. What is implants? Implants are implantable rod. Each rod is a matchstick, a size flexible and plastic. The method has a failure rate of less than 1%. A physician surgically inserts the rod under the skin of the woman's upper arm. The rod release a progestin can remain implanted for up to 5 years. Now, what is hormonal method, or short-acting hormonal method? There are 3 options. First is injectable birth control. Second is progestin-only pills. Third is a combined hormonal method. Now is the barrier method. There are so many kinds of barrier method. There's a male condoms, female condoms, contraceptive sponge, spermicides, diaphragm, and cervical caps. And then there are also emergency contraception. So what is this? It's a emergency contraception. There are copper IUD. The copper IUD is the most effective method of emergency contraception. The device can be inserted within 120 hours of unprotected intercourse. The method is nearly 100% effective at preventing pregnancy and has the added benefit of providing a highly effective method of contraception for as long as the device remains in place. Emergency contraception also have a pills, or ECPIs, or hormonal pills, taken either as a single dose or 2 doses 12 hours apart, that are intended for use in the even or unprotected intercourse. If taken prior to ovulation, the pills can delay or inhibit ovulation for at least 5 days to allow the sperm to become inactive. Sterilization method. There are two options. For woman, is a tubal ligation. For male, is a vasectomy. I'm going to explain what is sterilization method is. Sterilization is a permanent from birth control that either prevents a woman from getting pregnant or prevents a man from releasing sperm. A healthcare provider must perform the sterilization procedures, which usually involves surgery. Thus, procedures usually are not reversible. And what about the benefit of deficiency of contraception? I'm going to explain the benefit first. There are 7 benefits by using a contraception. First, it regulates menstrual cycles. Second, it makes period less painful. Third, it can banish hormonal acne. Fourth, it reduces a poor risk of uterine cancer, ovarian cyst. 5, it can relieve symptoms of PMS and PMDD. 6, it helps to manage endometriosis. The last one is it can help with the menstrual migraine. And how about the deficiency by using a contraception? That is conflicting priorities influencing the emperor or nouns of contraceptive include denial, guilt, excitement, duress, spontaneous, loneliness, crisis or pressure, hostility, and availability of abortion. Next, what is the side effect by using contraception? The most common side effect are spotting or bleeding between periods. This is more common with the progestin or only pills. Sore breath, nausea, or headache. But this usually go away after 2 or 3 months, and they don't happen to everyone who takes the pill. Birth control shouldn't make you feel sick or uncomfortable. Yeah, that is a presentation by me about family planning and contraception. Before I closing, I'm going to ask you guys, the audience, I'm going to ask Helpiana. Helpiana, can you hear me?
Yes.
Okay, I'm going to ask you, what is a family planning is? Can you explain? And can you answer me?
Yes.
Okay, great. Thank you very much for the answer. Now, I'm going to ask Arya. Arya, can you hear me?
Yes.
Okay, I'm going to ask you, what is the contraception method? Sorry, what is the method of contraception?
The contraception methods. Number 1, long acting reversible contraception atau LRC. 2, hormonal methods. Short acting hormonal methods. 3, barrier methods. 4, emergency contraception. And 5, sterilization.
Okay, thank you very much for the answer. Last one, I'm going to ask help you again, okay? What is the purpose by family planning is? This is the last one, okay? Help Yana.
Yes, What is family planning? An effort to regulate the number of births in such a way.
I'm sorry, that is okay, it's okay, it's okay. I really appreciate about the answer, but I'm gonna to explain again. That is family planning is it's okay, but I really appreciate the purpose by using a family planning is again the first one is prevent the emergency of dangers of pregnancy too early. Second one is prevent the emergency of the dangers of pregnancy is too tight. Third, prevent the emergency of dangers of pregnancy that are too based on the spacing of birth. And last is a prevent the emergency of the dangers of getting pregnant and giving birth too often. That is the purpose, okay? Thank you so much for audience, Halpiana and Arya. Thank you so much. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi
wabarakatuh.
Recording stop ya. Recording stop ini ya.